Paralysis. Although the cause of paralysis lies in the nervous system, which is kidney-related, the effect is on the motor function. And therefore, we discuss it under Wood. We are assuming that most patients consider acupuncture therapy after the acute phase of the disease has passed. Treatment should commence as soon as safely possible. Some examples of paralysis due to a peripheral nerve lesion: Bell's palsy, polyneuropathy, Peroneus nerve palsy. In fact, any peripheral nerve can suffer from injury after long duration of pressure, mechanical or energy block in blood flow, causing flaccidity, muscle atrophy, coldness, and weakness. The reflexes are very weak or non-existent. If treatment is started as soon as possible, then results are very good, and recovery occurs after 2 to 12 treatment sessions. Treatment principles. Treat locally and proximal to the affected area, going as close to the vertebral column as possible. Thick needles and strong needle sensation is used because sensitivity is quite low. Local atrophy can be treated with acupuncture or with interval frequency electrical stimulation. In China, thread embedding therapy was used with thick catgut. The idea is to prolong the period of local stimulation so that the muscle mass can build up once again. Acupuncture, which is actually intramuscular injection of vitamin B12, 0.5 to 1 ml, lasts for a day, whereas the catgut can last 2 to 3 weeks. The patient can do exercises in the interval between acupuncture sessions to improve the results even further. So we discussed 2 examples of peripheral nerve paralysis. Facial paralysis. Treatment should begin immediately. If the patient is on steroids, treatment should start as soon as this medication is stopped. Through and through needling is used. That means the needle should be inserted at one point and pushed in the direction of another point. We can stimulate both points in this way. Ideally, the needle should be stimulated with intermittent frequency electrical stimulation. And if the needles are well inserted into the muscles that are paralyzed, an exaggerated movement of that muscle can be produced and continued for a few seconds with a short break in between. We can leave the stimulator on for 20 minutes, but the muscle soon tires and the contractions become shaky. In this case, one should stop earlier. Points to use are gallbladder 14 in the direction towards extra 3, the middle of the eyebrows. Stomach 3 in the direction of LI20. Stomach 7 towards SI18. Stomach 6 towards stomach 4. Additional points. We use gallbladder 20 with elimination tonification, LI4 distal point, gallbladder 39 influential point for nerve marrow. At the end of the treatment, we could use plum blossom hammer tapping on the upper and lower eyelids. The eyes will close immediately after this. Treatment should be given for 2 to 12 sessions in all, depending on the rate of improvement. Peroneus nerve palsy or foot drop. So in Sri Lanka, we used to see this in workers in the jewelry trade who sat cross-legged on the floor all day while bending forward, thus pressing on the peroneus nerves. The palsy could be a symptom of pressure on the nerve by a prolapse disc, or it could be as a result of a stroke. In both cases, it is not an example of peripheral nerve paralysis. But in the case of a polyneuropathy patient, this is a peripheral nerve paralysis. In every case, treatment is similar and the results are good. Again, electrical stimulation with intermittent frequency to make the foot-raising movement should be considered. Acupuncture, intramuscular injections of 0.5 to 1 ml, vitamin B12 injections could be given at the end of each session. Points to use are stomach 36, GB34, all points with electrical stimulation, 20 minutes, stomach 38, acupuncture on 2 points at a time, and urinary bladder 58.